right, welcome back to the Final Shot Podcast. Today, the podcast is brought to you by Static. That's what's coming through the end on Adam's end because he's fucking dicking around in the kitchen. But we're also brought to you by Sovereign Extracts, the best CBD and THC product on the planet. We're also brought to you by Onnit. If you're not on it, get on it at onnit.com/TFS podcast and save 10%. Now, Adam, I'm going to ask you a question.
Fuck all your bullshit, Tanner. Let's hear it.
Have you ever put your fingers in something that you don't really like?
Yeah, Tanner, I have a lot.
All right, well, stop putting your fingers in things you don't like and stick them in a pair of USG gloves. USG Canada, the best gloves on the market right now.
That was a pretty good lead up, Tanner. Pretty good lead up. You got me rattled. Good job.
Hit my boy Howie up at email. Howie at usgcanada.com and place your order. If you guys go on the internet and you go check out Adam Braidwood on Facebook, not right now, but in another week, you'll be able to see Adam's fantastic new fight gear that he got from USG Canada. You look pretty good.
Right. Well, thanks. Yeah, it's actually, I was surprised because I got all the measurements and I was looking at it. I was like, oh, it looks shorter than my other stuff. And I put it on and it felt way better. Like, I felt super athletic and like, it was all the right measurements. It actually fit a lot better than I had anticipated because obviously it's not in person. I just did all the measurements. So I was like, this is really, really good gear. It was awesome.
Did it enhance
felt like I looked more athletic.
Did it enhance your athleticism?
I think so. I think that's probably the best fight I've ever done. And so, it's got to have a correlation with the gear for sure.
All right, let's get the fuck into the podcast and stop talking shit. We got a very special guest today. Adam linked up this podcast because he wanted to be a co-host again on the show for some reason. Well, we got Dr. Drew, and not the Dr. Drew that everybody else is going to know from that stupid TV show.
We got to get to that because this is a fight podcast. So the first question is, who could win in a fight? Our Dr. Drew or their Dr. Drew? And how can we set this up? Call Dana, call KO, call Camille. Let's get this fight set up here.
Dr. Drew,
he works out too. He works out too. But you got the age advantage, I think, and you got the football background. So I think I would give it to our Dr. Drew.
Hell yeah!
I think our Dr. Drew takes it just on biceps alone.
Correct. Yeah. Well, I mean, he's a successful CrossFitter too, so it's he has the clean and jerk, gives you a lot of power.
Nice.
I can go.
Thanks for having me on, boys. It's a pleasure.
Dr. Drew, tell us a little bit about yourself and what you do.
All right, so I am a naturopathic physician. I'm going into my 5th year of full-time practice in the Vancouver, BC area. My clinic is in New West, which is just a suburb outside of Vancouver, and I have a huge practice. Main focus is sports medicine. I love working with athletes. I have obviously an athletic background that Adam just alluded to. I also do a lot of men's health, hormone balancing, nutrition, digestion, and gut health. And I grew up playing a wide variety of sports. So played football, baseball, hockey growing up. And I've always kept that near and dear to me. So it was a nice transition into practice when I sort of left the athletic playing field to get into my sports medicine practice, and that's what I've been doing and building for the last several years. And had the chance to link up with Adam a couple of years ago at a random photo shoot, and now here we are 2 years later talking about what I do.
Yeah, it was totally random. We walked into a supplement photo shoot. I look and I was like, all right. I was like, so this is what you do for a living? He's like, no, I'm a doctor. I was like, oh, me too, obviously. He's like, what do you do? I was like, I fight dudes now and do these photo shoots.
That's hilarious.
Yeah, I can think way back like summer 2003. We were like practicing, playing football on the beaches of Kitsilano in Vancouver. So yeah, we've both come a long way, man. It's pretty sweet.
Yeah, definitely.
Wow.
Definitely. Yeah, it's great. Yeah, we used to train together. Yeah, just after high school. I think we did it even a little bit in high school too at Burnaby A rinks there.
Totally.
Yeah.
So you guys have known each other. You guys have known each other for a while.
We go back
probably
15 years.
15 years. Yeah.
Holy shit.
And then it's cool because then we all linked up. But we get into all that stuff later. You can start talking about stem cells and all that stuff if you want.
Yeah, we can get into that a little bit. Yeah.
Yeah, it's a small circle, Tanner. You know me. I get people in my web, and they all kind of interconnect. You get stuck with Redfern, and I get the doctor.
Listen, Daniel Redfern was very, very, very upset that you went off social media. I just told him that you blocked him.
I told him it was his fault. I was like, "You're annoying me too much." I had to get rid of my Instagram. Jeez. And he was like, "Really?" I was like, "No, I don't care. I just took a vacation."
All right, Dr.
So I'm
Drew.
getting distracted, Tanner. Talk to the doc, okay? He's fucking valuable time.
Can you shut the fuck up for 3 minutes? No, you can't. All right, Dr. Drew. You have a very interesting Instagram feed where you actually are like just handing out free advice to people.
Yeah, I do a lot of that. I have my daily health tips. About 5-6 months ago, I got into sharing daily health tips, and people have been responding really well to them. Because I find people are so misinformed when it comes to medicine, and they get caught in the conventional medical system. They end up with visits in their doctor's office that last no more than 5 minutes. No one ever gets to the root of their health concerns, and they end up on a ton of drugs and no better. In fact, usually a lot worse than when they first went in there. So part of my journey and part of my mission is sharing as much as I can with people actionable steps that they can take away every single day, and just give them little bits and pieces at a time. And then this just gives them an idea into my world and how I can help. And, imagine this for a second. If I can teach them something like that in a minute or two, imagine what would happen if they could spend a full hour with me in a consult. Or imagine if they became my patient and then I could teach them and work with them for several months and years. I could teach them tons in just a few minutes. So I always kind of just give little bits as we go, and it gets people interested, it gets people knowledgeable, and then when they're ready, usually inevitably people reach out because they want more and they need more. And then that's kind of been my my big marketing play this last little while. And then it's also my way of giving back. I mean, it's just my way of giving people some good actionable steps, and so far the reception's been excellent. I really enjoy doing it as well. So in a sense, it's helped me become a way better doctor, because the things I talk about and the topics I touch on, I'm constantly reviewing and researching and getting up to date on it. So I'm always delivering the most up-to-date stuff I can. So it's actually making me better, and it's allowing people to get access to really good free information. So I think it's pretty much a win-win.
Well, let's talk about something that's applicable to our world then a little bit. Not so much Adam because he's a heavyweight, but when it comes to a fighter's cutting weight.
Yeah.
It's obviously not a safe way to do it, like to do anything like that. It's not safe. But is there a safer way that people can do it?
Now, are you talking short term or long term, like an immediate cut, or like more of a long term play?
What happens a lot in combat
Probably
sports, it's both, yeah, because people will diet down 10 pounds and then cut the next 10 as on water weight, right? Somebody just turned on a fucking lawnmower here, now I'm pissed off.
Sorry, I got a SkyTrain in the background here.
It's okay, I'm eating a burrito.
Yeah, is there a safer way to do it?
Well, let's okay. Sorry, I want to add to that question because I have something in my mind. So the safer weight cut. Just to kind of build on the question, like, what would be some things that you feel would be missing or should be added to the diet because they're doing a lower calorie count? And then what would be the best things to have probably like after the weight cut when you're replenishing, maybe? Because I think you could probably talk about a weight cut for like an hour.
Yeah, I could. And obviously you guys would know some of the advanced strategies even better than I would. I played university at Simon Fraser, and the wrestling team would do some pretty extravagant shit just to dump weight, right? They'd go in saunas with garbage bags on. They wouldn't drink water. They'd be sweating it out. And now, does it work? Does it tip the scale in your favor? Well, yeah, but like the health implications are pretty risky, and you throw your electrolytes and water balance off enough, and you could be in real trouble. Or what's worse is you make weight, but now you have no energy, you're lethargic, and then you get your ass kicked because you cut too far and you limited yourself too much, right? I mean, so that's sort of like a broad look at how extreme things can get. But as a longer play, I'll give you a story for me. Back in 2006, I wanted to optimize my weight, my performance, my energy, because that's all I ever cared about, right? Growing up as a kid, I looked at food as like performance fuel, and so I wanted to make sure that fuel was top notch for me. That's why I got so interested in nutrition, because I knew it would help me on the football field. So in 2006, I did my first food intolerance or food sensitivity panel. And without even trying to lose weight, just eating the foods that are the best for you, I lost 10 to 15 pounds. My skin cleared up. I had great mental clarity. And so you get this side effect of weight loss when you start to eat the exact way your body wants you to. Now, the body's pretty dynamic. It's fluctuating all the time. The exact diet for you is not going to be the same as the person beside you, and it will change over time. But this gave me a glimpse into the best way to fuel my body. And like I said, the side effect of slow and steady weight loss and then consistently being able to hold it where you want it, that was a game changer for me. So in my world, when people are saying, I have stubborn weight loss issues or I can't cut weight properly, if you're eating inflammatory foods or foods that don't agree with you, you're going to hold on to fat, you're going to crank up insulin, and you're going to retain a lot of water. And all that's going to reflect on the scale. So then when you step on the scale, you're like, why am I puffy? Why am I holding water? We could talk about electrolytes and their implications on that as well. But that's kind of the arena I hang out in to sort of fine tune what maybe a fighter is already doing. And like, what's that next 5 or 10 pounds look like? And this is an advanced strategy to consider because, like I said, back in 2006 when I did it, it changed my life. So it's one of the most popular tests and things I do to screen patients with, whether they're an athlete, a fighter, or need to make weight or not. This is a topic I'll bring up and discuss with them because chances are they've probably done the technique where you water load and then cut it quickly, or maybe they're using some form of a sauna or sweat therapy. But I work with CrossFitters and Olympic lifters, and if they cut too drastically or try and dip down a weight class too far, then that may cause them to not podium, right? Or it may cause them to have basically, a shitty performance. So these are all things to consider where, everything works, but what works best is really, really important. So hopefully that just gives you an idea of kind of how I approach it.
How do you find the foods that are best for you? Like, do you offer like blood tests or like, what do you recommend?
Yeah, so the most simple way and most reliable way I found is a simple blood test. You take a small amount of blood out and it gets sent to a clinic we work with in Alberta, Canada here, and then they analyze it against the 120 or the 200 most commonly eaten foods. And that covers your standard North American diet. If there's really, really weird, obscure foods you're eating, they're not going to be on that panel. But I find that 200 catches about 90+% of the foods that most North Americans are going to be coming in contact with or building their meals from. From there, we can figure out what is your basically rocket fuel, what's the best fuel for you, and then what's your kryptonite food. So it basically puts it either a red, yellow, or a green label for each food. And from there, which ones you want to avoid and which ones you want to build your meals around. So it takes a lot of the guesswork out, because what most people don't realize with body composition and with digestive stuff is you can eat a food and not necessarily have a digestive symptom, but it might still not be the best food for you, because it's not always going to end up with a stomach ache. It's not always going to end up with like constipation or diarrhea. It may affect you in other ways. And this could be stubborn weight gain, or this could be a skin issue, or maybe joint pain. So I would say most of the digestive symptoms I see are not directly related to the gut, but it's actually affecting or harming the person in another system. Maybe it's the heart, maybe it's the brain. So that's the cool thing with the gut and nutrition and digestion is it's the hub of health. So if anything is wrong there, you can feel the repercussions of it elsewhere in the body. Any system will suffer.
And that's why he's a doctor, guys.
Yeah. So
that's awesome. So do you offer the test, or is there like a test you can do and like mail it in like at home? Or
yes.
Like what's...
So for those people that are near me or within British Columbia where I live, it's easy to get a sample done either in office or through the mail. And then for those out of state or out of province people, I have a different package and kit that I can mail. And then it's a small at-home collection, because the one I do in office, I do it out of the vein. But if people still really want it and they don't have direct access to me or a colleague similar to me nearby, then we can mail them a kit to collect at home. As long as you're okay to prick your finger and drop a few drops of blood on a collection sheet, we can then get the data we need to optimize your diet and your nutrition.
I can help out with that if anybody has a problem with that.
Yeah, if where there's a will, there's a way, and I get reached out to all the time with, I live here, or I don't have access to a doctor like you around here, and we'll make it happen, right? Because that's again part of my journey is just making sure people get good quality health care. And if
Cool.
you're eating at least 3 times a day, you want to make sure it's the right stuff. So I can't stress it enough.
Dr. Drew, do you do any kind of PRP?
Yeah, so a huge part of my practice is regenerative injection techniques. And what that means is any injection that's targeting ligament, tendon, or joint problems. And one of those injections I do is called PRP, or platelet-rich plasma therapy. I also do a ton of prolotherapy. So these are 2 treatments along with stem cells that fall under the regenerative injection technique umbrella. And PRP, for those listeners that aren't familiar, is when you take blood out of a patient, and say you start with 60 mils of blood, you'll then spin it down and have a tiny amount of concentrated platelet-rich plasmas at the end that you'll actually use to heal torn ligaments, damaged tendons, or maybe for osteoarthritis of the knee, for example, because we have the ability to heal floating around our blood at all times, but it's in a pretty diluted amount. So when you actually take a ton of whole blood, spin it down, and get a concentrated amount of PRP, you can introduce it to ligament tears, tendon problems, and joints that are inflamed. And this will actually be a way to supercharge and heal that area. And the cool thing is there's no way of really any bad side effects. The body's not going to reject it because it's your own tissue going back into you. And it's going to signal a huge healing cascade to occur for several days, weeks, and months after. And so this is just using what's within you to actually heal yourself. Most people, when they go to the doctor with pain or ligament, tendon, joint problems, they're going to be given a painkiller or they're going to be given a cortisone shot. And those do nothing to actually help the problem. They're complete Band-Aids. They don't allow you to heal. And it's just a matter of time before that pain pattern returns. So the therapies I use are geared specifically at healing and helping people restore pain-free range of motion and pre-injury status. So when you introduce PRP into areas that need it, the body takes care and does the rest. Now, I should qualify it by saying that it always depends on the person you're taking it from. So obviously healthy athletes that have no metabolic diseases, they're on no medications, they heal really well anyway. So when you give them PRP in the areas they need it, they typically respond beautifully. Now, if someone's a smoker, a drinker, they're much older, they have a huge amount of chronic health problems, they're not going to heal as well anyway. So PRP isn't always ideal for a patient like that. But when people check the boxes and they have a pretty clear-cut sports injury, between PRP and prolotherapy, I'm getting an awesome success. And it's such a big part of what I do because when I was a football player, back when I was just mentioning me and Adam used to hang out, I had a ton of injuries left over and I got caught in the system and nobody was helping me. And all they were doing was throwing drugs my way and sending me for scans and tests. So then I was treated with PRP and prolotherapy, fixed all my injuries up. So that's part of the reason I do what I do now, because I was like, geez, a lot of other people could benefit from this. They don't know about it. They don't know enough about it. They may not know how to access it. So that's part of my kind of crusade here, is to take it to as many people as I can, because I've seen such amazing results personally. And now in my practice, it's a huge part, probably 60% of what I do. So yeah, prolotherapy and PRP, 2 of my top treatments. Prolotherapy, for those that don't know, is a sugar water solution. It's a slightly weaker version of PRP, but it works awesome. So I always usually start there and then graduate people up the ladder as needed.
Yeah, that's interesting, because a lot of doctors that don't have a sports background, and so that's where I think a lot of like especially regular people don't really benefit from going to them, because people are starting to try to get working out, trying to get into fitness, and they get injured, and their doctor's like, here, take these anti-inflammatories, and then they get another injury, and then their liver gives out, and it's like all this stuff that can happen, and you've actually seen it and lived it. And Prolo, I've done it lots, it works, and it's all natural, and it's safe, and it doesn't like rip your liver up or your stomach or anything like that. It actually heals you too, right? So
none of that. Yeah, it's a good point, Adam. The side effects from some of these drugs, whether it's NSAIDs or Tylenol, they're horrible, right? Tylenol, one of the worst things for your liver, and then the NSAIDs, the number one cause of like ulcers and GI bleeds and emergency room visits. Yet that's the primary thing they reach for pain patients. And I mean, I first heard about Prolo and PRP. This was back in 2006. So it's been a while now, and I'm still, every time I tell someone about it, they haven't heard about it. Their doctor hasn't mentioned it to them. It hasn't been brought up by their physiotherapist. So again, that's why I just any media channel, any place I can get on, anyone that's willing to listen. I just want to get on here and talk about this kind of stuff because it's what I'm passionate about, and it pisses me off because I still think 15 years later now, people still don't know they have access to it. They don't even know it exists, and so I'm working hard to change that.
Well, explain to me exactly what cortisone is then, because I just had cortisone shots in my elbows. I'm guessing I fucked up.
Sure, yeah, and it may help. I don't know. We'll start by saying, did it help much, or how are
Yeah,
you feeling?
everything's fine right now.
Sure. How long ago was it?
A week.
Okay. So cortisone, it's an anti-inflammatory, so it's a steroid injection, and what it does is it completely shuts off pain, inflammation, blood flow, and immune activity in the area that it's injected. So if you're experiencing a bout of severe pain, inflammation, and swelling, well, of course, shooting a corticosteroid into that area makes a lot of sense if you're trying to knock those symptoms down, because it'll get rid of the swelling, it'll get rid of the pain, and it will drastically reduce blood flow and immune activity. And all that will reduce your pain temporarily. So the quoted amount of time you'll benefit from a steroid shot is anywhere between like 3 and 6 months. But some people will have a rebound with their pain like in as fast as 2 weeks, which means you're out of the woods right now, Tanner, for a week here. I don't know how long that'll last. Eventually, once it wears off locally, if we didn't fix the problem in your elbows, it'll just come back. So that's the concern with those. So when you actually do a compare and contrast between prolotherapy, PRP, and cortisone shots, everything that cortisone does, these other injections do the exact opposite.
Yeah.
So where cortisone gets rid of inflammation, PRP and Prolo increases a bit of inflammation because that's what you need to actually heal the area. And cortisone shuts down the immune system, whereas PRP draws immune cells and immune activity to the area, so your body will actually heal. If you look at what it does to ligaments and tendons, Prolo and PRP strengthens ligaments and tendons, but cortisone long-term weakens ligaments and tendons. So again, works for pain, but can set you up for long-term issues. And most sports med doctors will agree you'll never do a cortisone shot more than 2 or 3 times to any one area because it degrades cartilage and connective tissue long-term. So for joint health and longevity, that's not what we're going for. Mm-hmm. Whereas prolotherapy and PRP, very safe to do multiple times in one area as needed. And as Adam mentioned, all natural, broken down very easily by the body, where cortisone will systemically also suppress your adrenal glands for about up to 52 weeks after an injection. So that's another whole topic. But just some side effects to think about with that are usually not talked about during your conference or your consult with your doctor. These things are very much grazed over, and it's like, okay, we'll just do a cortisone shot in there. And most people are like, okay, yeah, that sounds good, not knowing some of the stuff I just mentioned.
Let's get into stem cells a little bit, because this is something I absolutely know nothing about. And my first question is could you take Adam's stem cells and put them in me?
No, you would not do that, because the chance of rejection and that would be poor medical practice across the board. Even if you want to be like him, that's not the way to do it.
I just wanted to grow a couple more inches, put on some more size.
Yeah. So to answer your question and just give everyone a brief background on it, the regenerative injection umbrella term that I've been using, stem cells is another term that falls under it, along with prolotherapy and PRP. Because if you look at the injection technique for all these treatments, they're all the same. It just depends what you're shooting. So are you shooting a sugar water solution? Are you shooting platelet-rich plasma? Or in your case now with the question of stem cells, is are you introducing stem cells back into the area that needs it? So stem cells are just, they're growth factors, they're satellite cells. They can pretty much morph and convert into anything. So depending where you put them, they can, again, change into a ligament, a tendon. They can change scaffolding and environments inside of joints, and they can work on pain and inflammatory pathways in a really big way. So people are rebuilding their joints. They're getting their life back. They're having chronic debilitating pain and injuries completely restored with stem cell injections, because what it is it's harvesting your own cells and, again, spinning it down and concentrating it and reintroducing it into the areas that you need it. So it's either pulled from bone marrow or it's pulled from fat cells. So it's a small procedure. So when you look at the other two I've been talking about, they're pretty straightforward. They can be done in under an hour easily. But a stem cell procedure is a mini surgery. So it requires an operating room, a team to extract, sterile technique. It's a little more complicated, and there's a few more steps involved. And so that's the big difference there. And if you look at the cost and the results, they're not even comparable. I mean, stem cell treatments are anywhere between, 5 and 10,000, sometimes maybe a bit more, where your prolotherapy is anywhere between, 2 to 400 a treatment. And then your PRP could be 800 to 2,000. So quite a big variance in cost with these treatments. So that's why, again, we always started the prolo, climb the ladder to PRP and stem cells as needed. And then recently, Adam and I have been linked up with a clinic in Bellingham that's offering an amniotic allograft injection, which is sort of under the stem cell umbrella as far as treatments go, but it's out of a vial. So what they're doing is they're taking placental cells and they're concentrating the stem cells out of there. They're putting it into a vial, they're freeze drying it, and then they're shipping it for people to use as treatment as needed. And the cool thing with this is you don't need the full operation. So the person can go get this treatment done and not have their own bone marrow or fat cells harvested from. You're actually using a placental extract, and it's following along the same lines as a stem cell. So we're seeing a lot of things branch off from the term stem cell. And some people would argue that you couldn't technically call what I just described with that placental extract a quote-unquote stem cell because it's not directly from that person, but it's acting and treating people in a very similar way. And we're seeing very similar results with these placental extracts as we are with actual stem cells and small operating procedures I was just mentioning.
What is the placental extract? That's obviously somebody's placenta, right?
Yeah. So I went down to the Surgenics laboratory. This is in Phoenix, Arizona, and they're harvesting these from obviously all over the country. They're rigorously screened, and then they're taking the placental cells that are rich in stem cells and they're concentrating it down, and they're just taking out the stem cell part. So the chance of cross-reactivity is pretty much little to none. It's all heavily screened for any communicable diseases. And then that is what's being concentrated into the injection that's being delivered into whether it's the knee or the shoulder, for example.
So would that extract have to match somebody's blood type then?
No, because all the immunoglobulins and red blood cells and white cells and things that we would react to. So say I was given the wrong kind of blood, you're going to have a huge immune reaction to that because the compatibility is not there. So they're actually removing in the extraction process all of that tissue. All that tissue's gone. So what you're left with is just the stem cells, the signaling molecules, cytokines, all the things that we need to control pain and inflammation in a joint and help redirect the body where to go to heal and actually fix the ligament, tendon, or cartilage.
So just because I'm a complete idiot, what's the difference between that extract and if you took something from Adam and then spun them? What would the difference be? I just want to know.
Because I don't have a fucking placenta.
Well, all I know
anymore.
They're only doing this with umbilical cords and placentas that I know of.
Okay.
I have not heard of anyone taking it from, say, Adam's either fat cells or bone marrow and then concentrating that down into it. That one I haven't heard yet.
I'm asking the next question. Okay, so we talked a little bit before the show a couple weeks ago, and so when shows like this come out, I think a lot of people get all these ideas that they got to do a million things. They're going to change everything. They have to do this, blood stuff, and it kind of can get overwhelming for a lot of people. And so I have the belief of like adding a few things as you go and seeing kind of what works for you. What would be like the five top things you would suggest that people would, maybe just changing their diet or like changing their routine to help be healthier? Like you talked a little bit about changing the diet as number one. Is there what would be the 5 things you could recommend, say, for an athlete who's competing to kind of make changes in their life?
Absolutely, yeah. So Diet for sure. I'll just say that would be number one. It's the biggest thing we do and the biggest thing we see sustainable, long-lasting results with, right? Okay, so figuring out the best food for you. Now, whether that's paleo or keto or everything in between, doesn't really matter to me so much because I'm not that doctor that's like, you got to pull this food, this food, and this food, and this food. I don't give those blanket statements where a lot of people are very anti-grain across the board or very anti-dairy across the board. It has to be individualized. So I'll start by saying an individualized, personalized nutrition program. The second one would be water. I didn't take this seriously when I was an athlete. Like, I just kind of knew, yeah, drink your water, drink when you're thirsty. I've done extensive training, obviously, through my my medical career here. And one of the big things that stood out to me years ago is when I did a course with one guy. He would basically lament about water. He was beating a dead horse. He wouldn't stop talking about it. And his big thing was people are chronically dehydrated. And since taking that course and taking it to heart and drinking my required amount of water every day, every patient I see has to be calculated how much water they're going to consume. Okay. Because thank you, Adam. Because everyone is super dehydrated, I've realized. And people walk around in a fog, in a haze. They have constipation, they have low energy, their joints are sore, their muscles are achy, and all that can be traced back to dehydration, heartburn, any stuff. So I found just getting people hydrated fixed 50% of the chief concerns on that one thing alone. So people will come in, whether it's depression or whether it's a diet thing or whether it's a joint pain or whether they have low energy. And across the board, when people get hydrated and take their water consumption seriously, all that stuff goes away. And then whatever's left over is the true symptom. So quite often people come in with a slew of stuff and it's like, let's just get you hydrated. The rehydration mechanism takes at least 2 to 4 weeks to reset. So I do a liter per 50 pounds body weight personally, and I calculate that same number for most people. And I'd say 4 out of 5 people, when I tell that to, their jaw hits the floor and they go, holy shit, how am I supposed to drink that much water? And I say, you just have to get it done. You have to bring a large bottle around with you, and you have to consume a liter per 50 pounds body weight. And for athletes, it should be at least that. So what Tanner has there, you need something big like that. These small bottles, cups, mugs, and glasses will simply not cut it. You will not hit your target amount if you don't have a huge enough water bottle. I just bought a 36 ouncer. I think people need at least a 3/4, if not to a liter, that they track their water intake with. That has been a friggin' game changer for me. So since you've given me the platform to do it, I'm going to harp about it because people do not take their hydration seriously enough. And that's been a huge one for me. And all my patients that get hydrated notice a huge change. And athletes would be no exception. In fact, they might need more because if you're sweating more, you're losing more. And so that would be a big one there, would be the water. And then on that same line, because if you hydrate or overconsume water, you have to make sure that your electrolytes in check. So number 3 would be salt and electrolytes. Another very sort of under-considered one for me for the first few years of my practice. Oh, where'd Adam go?
He left. He'll be back.
Yeah, and under-consumed one for me would be salt. Salt and electrolytes in general, particularly magnesium. So I recommend everyone, if they're drinking that amount of water, you have to salt all your food to taste. Do not be afraid of salt. You want to use pink salt, red salt, sea salt, and occasionally table salt because it has a lot of iodine in it. You need all those trace minerals. You need to make sure you're salting your foods and getting your electrolytes. I can't state that enough. And then magnesium would probably be the number one thing that most people are deficient in that they can benefit hugely from. I just did a small segment on this the other day. It's involved in over like 300 reactions. And for any performance, heart health, immune system, muscles, sleep, anxiety, I can't stress enough the importance of taking magnesium. I find that most people need that one because I always get asked the question, you know, like, what supplements should I take? Or what are like the top 5 I should be taking? Magnesium would be right up there with one of them, as would vitamin D, just because I find most people don't get enough sun and direct sunlight, and especially for those living in Canada or in the north part of the United States, you're not getting enough sunlight to create enough vitamin D, and that leads to a slew of immune system, heart, and mood issues. And just from a public health standpoint, if people made sure to consider taking magnesium and vitamin D, they'd be feeling a heck of a lot better. Another big thing, because Adam's looking for his top 5 there, would be you need to move and exercise um, at least 4, if not 5 times a week. I always get asked what the optimal number is, but you have to be moving more. So if there's 7 days in a week, you need to be moving at least more than half of those. So I've put my number at least 4, minimum of 4 bottom line. And then on those other days, they're not off days. You're not laying around. You have to be walking. But the minimum number I found is at least 4 for most people, and there has to be some resistance training. I don't care if you're young, old, injured, athletic, non-athletic. There has to be some resistance training in there, because if there's one thing that's given me my my success and happiness and just my overall health is muscle. And I know it sounds really simple, but the amount of things muscle fixes is crazy. Okay. It starts way back when we're younger. It could be self-esteem issues. It could be, drumming up the courage to ask that girl out. It could be athletic performance. And now I look down the road from a metabolic standpoint, just how much it helps you balance your blood sugar. It wards off all levels of disease, your balance, your coordination. All that matters as you get older. And the number one thing that happens is when people lose their strength and lose their muscle, that's when things start to really go downhill. They've looked at all-cause mortality, and when you take out all the nasty chronic diseases, people that have better grip strength live longer, that one marker. And so if you just track that one thing over time, those with stronger grip strength live longer. And as soon as you start to lose grip strength, balance, and coordination, it's just a matter of time before your time is near. So yeah, muscle. I can't stress that enough. Resistance training, and I'm not talking about 10 plus reps per set. I like, 5 sets of 5 with a decent amount of weight is kind of where I always steer a lot of people as a baseline, and then we can always branch out from there. But muscle for sure. And then the other thing would be sauna therapies and sweat therapies. I think are kind of a newer one, but I was going to say sleep for my last one, but most people have probably heard, yeah, you should sleep more. So I'll give you guys one a little more interesting that's kind of come a lot higher on my list this last little while. Sauna and sweat therapy from a detoxification standpoint. If you look at where we live, we're not really on planet Earth anymore with respect to how much toxicity there is. The food and the water supply is all very tainted. Things are sprayed all the time with the wrong kinds of chemicals. People eat a lot of processed food. And then on top of that, a lot of people are taking medications. So the toxin level in our body is exceeding what we can eliminate. And the easy way to eliminate it is sweat on a regular basis. That's why exercise is so goddamn important, because it's just another way to get stuff out. But that's an active form of sweating, which means you don't actually detoxify and lose your toxins as fast as you could when you're actively sweating. So if you look at a sauna or infrared sauna or steam room, that's passive sweating. So you're just sitting there and your body starts to pour sweat in a passive state. And that is one of the best ways to actually reduce your toxin load and to clear your body out. So there's less for your liver to do. There's less for your fat cells to hold on to. And it's probably one of the number one things that's causing a lot of chronic disease in most people is they're taking in more toxins than they can get rid of. And we're seeing stuff now that we never saw hundreds of years ago. But like I said, the shape of the earth and where we live has changed so much. So yeah, that would be kind of the big ones to think about. And yeah.
I have a question about water then, because these jugs, that the one I held up is 2.5 liter jug. I try to drink 2 of these a day. Now, we do push drinking water on people kind of hard, like at our gym and people that we train with. You got to drink water. It's if you dehydrate
it's
yourself,
non-negotiable.
You're fucked. Now their biggest thing that they say is water's boring.
Yeah, for sure.
Is there anything that people can add into their water so that it's not boring? That's going to be healthy. That might enhance the effects of the water.
Yeah,
sure.
Insert toughness.
So you can add really whatever. I always try and get people to start with pure water, but if they're like, hey, I hate it, I can't get it down. So in mine, for example, I use an electrolyte beverage, which is just basically seawater that they take most of the salt out, and then it just has all the trace minerals in it. So it's actually really high in magnesium, potassium, and a few other things. And I find that changes the flavor of it just a bit, and it helps me absorb it, so it feels like it's not running through me. I mean, past that, if you just want some lemon, some lime, cucumber, sometimes people put fruit in there. It doesn't really matter. You can also find at our clinic up front, they have stevia drops. So these are sugar-free, flavor drops that you can just add to your water, and it basically tastes like you're drinking a juice or a uncarbonated pop. A few drops of that takes the edge off really, really nicely, because if it's between someone not drinking their water and drinking it, then I definitely allow them to add something to it. I don't always start there, but yeah, when we hit a roadblock, you got to put something in there. You could even put a pinch or two of pink sea salt into it, and it just gives the water a nice mouthfeel. It's not going to taste salty unless you overdo it, and that changes sort of the taste and complexion of it just enough that I find that usually works well for most people. And then at the end of the day, it just ends up being a non-negotiable. I have people come back to me, I'm in the bathroom 10, 12 times a day, like, this is ridiculous. And I say, like, so be it. That's just what it has to be.
Yeah. Now, you got these flavored BCAAs. Are they cool to throw in there too?
That would be fine. Actually, now that you mentioned, I have a flavored glutamine powder I use, and it's sweetened with stevia. And for you guys who grew up, did you have that Lipton's iced tea? Do you ever remember that Lipton's iced tea drink? Yeah. The one that was like out of a big blue canister. This stuff I use, it's a glutamine or a BCA flavored like iced tea. There's no sugar in it. That stuff's fine too, because I actually sip on that quite a bit myself. I'm a big fan of BCAAs and a big fan of glutamine. A lot of people lately would say that BCAAs don't hold up in research, and if you're eating enough protein, you don't need to add them. I've always added them. I've always liked them. I don't think it's going to cause any harm. And yeah, if it has enough of a flavor and a few extra calories and protein, then they're no concern at all.
You got questions, Adam?
No, I was just writing some stuff down that he said. Yeah, I heard something about like are low on iodine now, and I didn't realize that pink and red salt were good for you. I was going to ask you, where do you get the sea salt water? Is that just something you have at a nutrition store or something?
Yeah, so one of the nutraceutical lines I work with, they're Physica. They're out of Eastern Canada. They're for practitioner dispensing only. So it's stuff we can order in as doctors and dispense to our patients. But that said, I have seen these electrolyte drops and this desalinated seawater at places like Choices and Whole Foods in their supplement section. And then, I just add a few squirts of that to my water, and I absolutely love it. And that's where I get my ionic magnesium that way, and it helps me enjoy consuming as much water as I do, because at my body weight I'm around just over 200, so I need like 4 liters a day, and I find on the days I don't get it, like I notice it, like I'm just foggy, I can't think as clearly, I'm not as sharp, or maybe a few extra aches and pains. And so, man, don't underestimate this one. Get the water intake any way you can, for sure.
Do you prescribe CBD or THC to patients, stuff like that?
So with our board, because I have to answer this with my college listening potentially, we're not supposed to either help people get access to any CBD, THC, or cannabis. We do have a lot of herbal training as naturopathic doctors, but I can't prescribe it to them. I can't really counsel them on how to take it or not take it. But with me saying that disclaimer, I'll say that I've seen amazing stuff with it, and my patients that do take it, it's an awesome adjunct. A lot of people that are on polypharmacy or tons of medications can remove a lot of them when you actually add things like CBD and low-grade THC to the mix. So it's a wonderful plant when used properly. My issue with it is when people come in, looking for sources on it because they just want to get baked or high or stoned. And that has no interest in me. But if I actually look at it from like, anti-inflammatory properties, people with really bad anxiety or sleep issues, or just an athlete that wants to recover at night and have a really good day the next day, I think it's a fantastic supplement to consider. And now with it being legalized in Canada, you can buy it from the government store quite easily. They'll ship it to your house, and there's nothing illegal about that. And CBD with, a little bit of THC in there to drive it is a wonderful product. You want to keep the THC obviously very low, so there is no sort of that like body high or stoned effect. But all those other benefits I listed come from CBD, so no concerns at all there.
Adam's probably getting a phone call right now. That's why his video turned off. But
I had to plug it in, but I couldn't see if it was charging or not. So I put my disturb when we're doing it, and then Rich texted, and I was like, "Oh shit, I better answer that."
Oh yeah, you got to answer those ones. He might end up calling you and yelling at you.
Are you?
Where were we? What were we talking about? The CBD and the THC.
Yeah.
I use the CBD all the time. I don't like to get high because I get weird
Yep.
and it doesn't react well with my brain. But I like the CBD stuff. It takes a lot of the inflammation. I've had a few knee surgeries, as I know Adam's had a few knee surgeries. I'm not going to pin anything on him right now, but I use the CBD for that a lot. It takes the
Yeah.
pain away.
No, I think it's great stuff. 100%. Yep.
Uh, I'll go back to that prolotherapy and the PRP. I've actually had PRP in my Achilles,
Oh yeah.
which worked very well. And then I had prolotherapy, and I didn't even know I was getting it on my back.
Okay.
I went to the sports guy in Red Deer, and he's like, "Okay, I got to do a whole bunch of like little injections in your back," and he like went down my back, and I said, "What the fuck is this?" It was just sugar water. I was like, "Oh,
Yeah, that's
great."
all it is.
Now, what in the sugar water helps fix things? That's weird to me, right?
It is, right? Yeah, no, it's a great question. So we look at dextrose or glucose. That's, obviously the energy of the body, and any food we eat gets converted into glucose. So this is a bottle of glucose. So on its own seems pretty benign, but it's very, very concentrated. So if you look at the percentage of the dextrose when you inject it into an area, it actually ends up being quite an irritant. So when you put it on a bone where a ligament or tendon meets it and you inject it, it's actually very irritating to the tissue locally because it's very concentrated. It's a lot more concentrated than what would be floating around in our blood. And what that does is it causes a huge immune reaction, and the area basically gets pissed off. I mean, think of like picking a scab and it starts to bleed. That's kind of what you're doing every time you do prolotherapy in an area. It's like you're picking a scab, you're causing a small wound and a small amount of inflammation. And then from there, the body will send blood to the area, white blood cells, red cells, immune molecules. And then that's how collagen starts to get laid down. And that's what ligaments and tendons are made of. So the more collagen you can direct to an area, the stronger those connective tissues will be. So the other cool thing dextrose does is it dampens pain receptors. So when you flood an area with sugar, the surrounding pain receptors bind it, and then you actually get a dampening and down regulation of the pain receptors. So kills the pain, helps draw the immune system in, acts as an irritant, and then it's just sugar at the end of the day, so it gets absorbed up. Like really no harm, no foul. Very, very benign solution in the sense of nothing can really go wrong unless you put it in a completely area you didn't intend to. Yeah.
Adam, you've had prolotherapy, yes?
That's effective. It's definitely something that I'd recommend. So yeah, like I said, just adding little pieces to the puzzle. So through my sports career, what I've noticed, and you can probably relate to this, is longevity is crucial, right? So a lot of guys, especially MMA and stuff like that, they're getting hurt, they're missing fights. Getting back from the field to football games long term is super important. And I think a lot of physiotherapists, especially in the sports world, are just trying to get guys out there for that one game or the next game. They're not thinking, next season, 10 years from now. So I think when you add things like this, it increases your longevity. And the more you take care of yourself, it's just like basically putting a little deposit in the bank. So when you do things like prolotherapy, I had it done. I think my sciatica was up, and the guy said it's really hard to stabilize because it's in a weird area, right? It's not like you can all of a sudden just work out your sciatica if you've never looked at it in a biological diagram. And he did it, and then I had I added some other things to that, some stretches and some strengthening exercises that definitely helped. And then soon after that, I really didn't have problems much. I addressed it, built it up, and I felt a lot better for the long term, right? As opposed to once every 3 or 4 years, I kind of like tweak it a little bit. Now it's consistently feeling better and better.
Yeah.
But Dr. Drew, what's the number one thing that people come to you for then?
Would be the regenerative injection techniques. Yeah.
That's your bread and butter then. That's what's paying
That's
the bills.
my bread and butter. And that's what I love doing when I see my calendar or my day full with that kind of stuff. Like it just, that whole, like, it doesn't feel like work. And there's a lot of truth to that statement when I'm working with patients that are dealing with any problems like what Adam just described, and I get to use these treatments with them. That's fun for me. That's a lot of fun for me. And that's what I put my most time into training, because when you go to school to become a naturopathic physician, you only get so much time in each, sort of discipline and module. So I put a ton of extra time and study and continuing education and shadowing and research into this. So That's why I do what I do, and I've gotten very proficient at it over this last little while, because it's like anything, it's a skill that takes time to learn. There's a lot of people out there doing prolotherapy, but you have to get it in the right spot. You have to know how to assess someone properly, but you also have to know the world they come from. So for me, it works because, I played football, I lift weights, I've done a lot of this stuff. So when someone comes in and says, it hurts when I do this exercise, or I tweaked it doing this, I right away know the world and the arena they're hanging out in, where sometimes doctors have no context, right?
Mhm.
Someone comes in and says like, well, I hurt my back deadlifting. And they're like, well, probably you should stop deadlifting. It's like, well, you don't even know what a deadlift is. So I can talk to people at a much different level, and because I've walked a lot of it. Now I haven't done the high end fighting that Adam's done, but I know enough about his training and everything he's been doing, so that if he has a tweak or a pain or an issue, I know how to screen him and talk to him about it and understand kind of what he's doing behind the scenes. And you have to take all that into context, right? Because again, everyone's a little bit different there with that. So that's what I really bring to the table with this, is that sort of that personal touch and that athletic background on top of the medical expertise.
So you say that you have to put it in the right area and find the right spot. How do you find that spot? Not everybody's built the same, and I'm guessing that not everything's in the same place. So do you have to use like an ultrasound or something to find where to put it?
So there's lots of ways to do it. And back to your thing where not everyone's built the same. If you actually look at the skeleton, when you peel like all the muscle away, all the bones and all the attachments for the muscles, and once you learn anatomy, it's pretty consistent person to person. Now, of course, size of muscle changes and thickness of tissue and all that around it. But when you really peel it all back, very consistent where a certain landmark is going to be, or where a specific joint is going to be. So once you learn that really, really well, you're 10 steps ahead of the game, because it's not changing too fast. Past that, you need to do good orthopedic testing. So this involves special tests of joints. This involves muscle testing. But really, Tanner, it comes down to good palpation. And what that means is, can you put your thumb and fingers onto spots and find where the pain is? And you do that through, like I said, a variety of testing, poking around. And then on top of that, for a high-level diagnostic, you can use an ultrasound to actually look through the skin and go, okay, is there a tear? Is there fluid here? Is there something going on where it attaches to the bone? And so you can bump it up another notch from there. Now, there's, I'd say, a good chunk of prolotherapists and injection guys that use ultrasounds, and then there's a good chunk that don't. So you kind of find everything in between there, because you need to make sure that this injection solution is dropped where the ligament or tendon is damaged and where it meets the bone. And then from there, you use various techniques to make sure that you're, I guess, hitting all the spots you need to and not leaving any spots untouched.
Okay, I'm going to focus on Mr. Braidwood here for a couple of minutes, because this past weekend he has accomplished something that's very hard to do in the sport of boxing, and that's make a comeback. And he went over to Montreal and knocked his gentleman out fairly quickly, and might I add, in amazing fashion. You look great.
Hey, thanks, Tanner. Yeah, it was a long layoff, and I always tell people I don't have a whole bunch of fights, but I've been a competitor for a long time. So, playing, we go every week, and as Drew knows, you got to get ready every week, even if you have a bad week. The week before, you got to constantly refocus. So I have that ability in my mind to be able to do that. And we were offered some fights a little bit earlier, and Rich is really good at knowing me and knowing what I need. He said, give it some more time, And we were supposed to do the one in Vancouver, and then he was injured. And, going back to Quebec was good, right? It's a lot of pressure, but that's kind of how I fight better. I get calm in those situations. And I was confident in my skills. A lot of times I'm just going out there and fighting. And this time I knew I'd be able to box this guy. I knew I was ready. And, it was just preparation. I did a lot of things differently this time. And so now I feel like I have the template to be a lot more successful. Cheers.
You did it on a pretty big stage too. Eye of the Tiger Management, the rematch, Simon Keane versus Dylan Carmen, and you were on fairly early in the show too, which is not normal for you.
No, and it was good. I was glad to do it, because then I wanted to go watch the rest of the show. I hate sitting around waiting for fights. Like, I would like to just walk in the stadium, walk up to the ring, do my thing, and get out. It was cool, and I got to watch the rest of the fights. And I think interacting with the Quebec people was the coolest thing. I think Rich counted. I took almost 400 photos just walking through the crowd. Jeez. And you know, people don't know Quebec. I mean, there's 2/3 of Canada's population there, and they are all fight fans. Mm. So I think it was a loud crowd. I think there's like 7,000 people there. Crazy energy. And everybody knows who you are. They know everything about you. They're super polite, and like I think they're always like thrown off a little bit because they're like, "Hello, my English isn't that good. Can I take a picture?" And like they kind of flinch. Like, "Hey, relax." I go, "Let's take a picture," and I smile, and they're really receptive to that. And you know, I took a lot of time to be able to do that. It was a huge card. It was on TV out there. And you know what? Like I said, I like big fights. I want more fights. We got some coming up really soon here, hopefully. And I just want to keep the ball rolling now.
I don't normally ask you any weird questions, but being off...
Since when? Since when? Ask if you could have my placental stem cells.
Being off for a year, all the personal bullshit that went on, and then... You make your comeback, you walk through the curtain, you see the crowd. How'd it feel?
Oh, it was awesome, man. It's what I live for. It was fun. I was singing. I even got to the venue. I was like, you know, I just put on an 80s song, man. Let's enjoy this. Let's enjoy the party. Because I think a lot of fighters, they get too worked up. Like, oh, I got to fight this guy. It's tough. It's hard. I'm like, man, it's party time. Like, this is what I like to do. I go back to my hotel room, eat a pizza, get back in the gym on Monday, and have at it.
No injuries, nothing certain. Didn't get hit.
I was in the gym on Monday, man.
It's all good then. Nice.
Yeah. Exactly. So be ready. We got some stuff. I'm gonna get my social media back up just for this segment. I'm gonna have to do it on Tuesday now. So send me all the...
You said 2 weeks off.
Yeah, you know, it's fine. I always lie, so.
All right, well, let's wrap this thing up. Dr. Drew, if people want to get a hold of you for any of the stuff that we've talked about on the show today, where can they get you?
All right, so my Instagram handle will be the best way to get hold of me. It's just at drew.jamieson, so drew.jamieson. I'm also on Facebook there, but Instagram would be the number one thing. And then my clinic in New West is Polo Health, so it's POLO health.com is the website.
Adam, they can't find you on the internet right now, can they?
I'll find them.
And that's the final shot.